My name is Emily Green. I'm a class of 2018. I graduated from the nursing 3 and 2 track. So I did my biology degree at Washington, and then I graduated with my bachelor's in nursing from the University of Maryland. I moved out to Seattle about 2 years ago, spent a little time in the ER at Seattle Children's, did a little pediatric operating room. Now I work in an urban safety net clinic. I take care of mostly recently resettled refugee families. I'm also in the Doctor of Nursing Practice program at University of Washington. I'm going to concentrate in pediatric primary care.
Why don't you tell us a little bit more about what you're currently doing in your position?
Right. So in my current role, I do a mix of hands-on care and kind of complex case management. We take care of mostly recently resettled medical refugees from East Africa. Our clinic is all about delivering care through an equity lens. So we're always trying to provide that wraparound service that you just don't get even at kind of other community health centers. We do a lot of behavioral health. We have a social worker, dietitian in clinic. So our families can get social work support, lactation support, nutrition support. We have a women's clinic next door. So we're kind of working on integrating the two clinics to do more comprehensive postpartum care. We're university affiliated with the University of Washington, so we're big on quality improvement and evidence-based practice, and I've really been able to define this role, and it's been really exciting. I didn't initially see myself in primary care. Dr. Kanatan could probably attest to the fact I was very ER driven, but a lot of those visits I was seeing in the ER just felt really preventable, and this is definitely where I want to be, and I hope to keep working with this population going forward.
Can you say a few words about whether it was easy or difficult to get a nursing job? Is getting a nursing degree something that's going to get you a job and something that's going to be something that you're going to be happy with?
Yeah. So funny story, when I was in nursing school, I did this externship program at Shady Grove Adventist Hospital in Rockville, and Chris Wilson is the assistant nurse manager of the pediatrics ER who graduated from Washington College, right, from the biology program. So that was awesome. I love that experience. Unfortunately, life circumstances brought me out to Seattle, but finding a job out here was super easy. You can do so much in nursing. I was so focused on, working in a top 10 hospital in a competitive specialty, but the reality is there's so much, and nursing doesn't just look like hospital nursing, and you will find a job if you graduate. And even if neonatal intensive care is what you're dead set on, you will find a path to that specialty.
How did your classes and labs at Washington College, biology and other, and maybe even not even science classes, how do they prepare you for your career and your current work situation?
So my first anatomy lab with Dr. Krochmal, we had this exercise where I think we were identifying the species that all of these samples of skin belong to. And so, there were several samples set up throughout the room, but one of them was bone. And the whole point of that exercise was for us to be able to say, hey, I know what skin looks like, and I don't know what that is, but I know it's not skin. And he called that academic confidence. And if you work in healthcare, whether you're a nurse or a doctor, I'm a year and a half into my career, you're going to run into a situation where your colleagues kind of share this mental model about a diagnosis or a treatment plan. And something is going to say, I know what normal looks like, and this isn't normal. And you can't just not speak up because you're not the physician in the room, or because you're brand new, or even because you're a student. So that concept of academic confidence and I know what I know I think it's impacted my patients' outcomes and certainly brought me where I am in my career.
Are there any other opportunities, or did the fact that you have had a number of labs, did that practical experience translate into your nursing school and into your workplace?
Yeah, I think having a hard science background has totally set me apart, both in terms of my resume, but just how I can think critically in a totally different way than my peers. I think at Washington, you're kind of, because of the relationship you have with faculty, you're held accountable in a different way. And you're held to a higher standard. And I think there's a commitment among students that's a little bit different than you're going to find anywhere else. I think getting the biology degree, I came in to my pharm classes, to my patho classes in nursing school with a really solid background. I was also able to use that 3 years I spent at Washington to build my resume. So I was one of my only peers in nursing school. I worked full time in the ER, getting experience as an ER tech. I learned how to place IVs and do EKGs and do Foley catheters. And I worked as an EMT on the ambulance, so I knew how to assess a patient and talk to a patient. And I wouldn't have been able to develop those skills if I hadn't had the time at Washington College. So I think that's a huge benefit of the Nursing 3 and 2 program. You can use that time to figure out what you really want to do.
What is one thing that makes you nostalgic for Washington College?
I love the West Coast, but I am a small town country kind of person, and Chestertown, I just, you cannot find crab cakes out here in Seattle. So I'm definitely nostalgic for Chestertown.
What would you like to say about your current career and how a degree in biology or just being at Washington College helped you get there and succeed there? You've talked a little bit about this, I think, already.
Yeah, I kind of spoke to this before, but at Washington, you can't really just blend in with the crowd. You can't say, oh, I'm not interested in ecology, so I'm not going to take that class. You are going to come out well-rounded. You're going to come out knowing how to read a research article. It's just not an option. And yeah, I've been able to kind of share experiences with other colleagues and friends who have graduated from biology programs. And they'll talk to me about how their Gen Bio class had 300 students and there weren't enough seats. They had to sit on the floor and it was hard to connect with the TA. And that is just not a Washington College experience. My Gen Bio faculty wrote my letters of recommendation for nursing school.